everyone. My name is Angie Peacock. I'm a psychiatric drug withdrawal consultant and a healing coach. I like to bring you interviews that are important to me about subjects that have to do with the psychiatric drug withdrawal community, people that are using services or leaving services. Today, I have Dr. Peter Gøtzsche. He is joining us from Denmark. I'm so excited to bring him to you today. Me and Peter met in person about 3 years ago. We did a film screening of Medicating Normal in Toronto, and he's been a hero of mine. I just love all of his work. I read everything that he tweets about. I love all of it. So I'm so excited to bring him to you today. Welcome, Peter.
Oh my goodness, you'll be busy if you read everything I do.
I know, you tweet a lot, you do. All right, so let me read his bio really quick, and then we will jump right into questions. Dr. Peter Gøtzsche is co-founded the Cochrane Collaboration, which is considered the world's preeminent independent medical research organization. In 2010, Gøtzsche was named Professor of Clinical Research Design and Analysis at the University of Copenhagen. Gøtzsche has published more than 70 papers in the big 5 medical journals: JAMA, Lancet, New England Journal of Medicine, British Medical Journal, and Annals of Internal Medicine. Gøtzsche has also authored 4 books on medical issues, including Deadly Medicines and Organized Crime. Following many years of being an outspoken critic of the corruption of science by pharmaceutical companies, Gøtzsche's membership on the governing board of Cochrane was terminated by the Board of Trustees in September of 2018. Half of the board resigned in protest. What do you think when I read your bio like that, Peter?
Well, I need to correct it slightly.
Okay.
Because I have actually published over 100 papers in the big 5 by now, which very few people in the world have done. And also I have written a good deal more than 4 books. And about Cochrane, it was a highly respected institution, but when they kicked me out, considering I was a symbol of honesty and integrity and science at a high level, it was a very bad decision for them. As one of my friends said, they thought they could strangle you in the basement while nobody was watching. But there was a huge uproar with articles in Science and Nature, BMJ, Lancet, everywhere. And a lot of people lost confidence in the Cochrane Collaboration because of this. And right now they are struggling to survive. And some of them, quite frankly, don't think Cochrane will survive because they have been stripped of their major funding from the UK Health Service. So almost all groups in the UK have closed down now. And this is because the quality of their reviews is not good enough and they are not quick enough, and it has become too self-serving with actually editorial censorship has stepped in, and we have seen that several times the last couple of years. So it's a very sad story about a once magnificent organization.
Is industry influence infiltrating in Cochrane now too?
Yes. When I got elected to the governing board, one of my first tasks was to say, we cannot accept that half of the authors of a Cochrane review are allowed to get direct funding from the company, which product they are reviewing. I mean, this is ludicrous. And this was agreed, and I wrote a new policy in an afternoon. But it took Cochrane 2 years of consulting with its members before it came up with a revolutionary idea. From now on, only 1/3 of the authors were allowed to be directly paid by the industry whose products they are reviewing.
Wow.
To be quite frank, this is crazy. Semmelweis did not tell doctors to wash one of their hands in order to avoid contamination. He told them to wash both hands.
Terrible. Ugh. All right. So can you tell us, Peter, like, how did you become a scientist? Like, how did you get interested in the corruption of industry influence?
That's a very long story that I will abbreviate, because I first became a biologist and then didn't know what to do with it. And my grandfather, who was a general practitioner, he told me, why don't you go to the drug industry? And I hadn't not stayed there long before I realized that they manipulated their research to an unbelievable degree. And what the salespeople told doctors in some cases directly killed people. I was appalled by it, and then I started studying medicine while I still did trials for the drug industry and got new drugs approved by the drug regulators, and then I became a doctor and took an interest in bias, of course, because a lot of the literature is very biased. And talking about psychiatry, I have documented and written about that Cochrane reviews of psychiatric drugs, they are virtually all of them pretty unreliable, because what the drug industry publishes in terms of placebo-controlled trials are highly flawed.
Right.
So there are several Cochrane mental health groups, and most of what they publish is just unreliable. And then it's pretty ironic that the motto for Cochrane is trusted evidence. This is not trusted evidence. People can more or less forget about it.
So let's start there. I just read your book, Mental Health Survival Kit, and it was excellent. It was like a crash course in all things that are wrong with psychiatry. Can you talk about?
There's a lot to talk about.
It was a lot. There's so much to talk about here. But I'm also thinking about your recent tweets about the STAR-D trial. So I guess, can we just start with like, what is wrong with the evidence base in psychiatry?
Well, psychiatry has let themselves becoming totally captured by the industry's interests. And now you are from America, and American psychiatry in particular is totally corrupt. And unfortunately, American psychiatry has a big influence on the rest of the world. And Bob Whittaker has written books and a lot of articles about this corruption, and so have I. And if we talk about the STAR-D trial, then this is the biggest and longest running study that has ever been performed in the world. It was financed with $35 million by the National Institute of Mental Health. This is so much money that you and I just can't understand that it should be so expensive to do a rather simple study, which was not placebo-controlled. All the patients were started on citalopram, Lundbeck's depression drug. And you might ask, why on earth did they do that? Very strange. And then if it didn't work too well, they could change to another drug and to a third drug and so on. And then they carried along and published more than 100 papers about their study. And basically, it was revealed quite recently, but also earlier, but very much so quite recently, that this is a huge fraud. And it's not honest mistakes. It's deliberate fraud that was carried on by the investigators, and the National Institute of Mental Health just propagated all these fraudulent results, saying that 70% of the patients, they were well and had taken advantage of the drugs after 1 year. And, you know, in reality, it was 3%, not 70%. I have rarely seen such a big discrepancy in my whole life.
Wow.
So basically, what the study showed is what we already knew, that depression drugs, they don't have any meaningful benefits. They just have a lot of harms. That's what the study showed, but it was sold as something else. So these psychiatrists and the National, Institute of Mental Health, they behaved at least as badly as the drug industry does.
That brings the question. I mean, I hear it a lot that drugs work, psychiatric drugs work. Do they work according to the evidence?
No, they don't. I have written a lot about this in my books and scientific articles. The psychiatrists themselves have determined what is the least clinically relevant effect, both for a depression drug and a psychosis drug. And when you then look at the placebo-controlled trials that the drug industry has made and they have manipulated the results, they have exaggerated the benefits. But even so, the benefit is a good deal below what you can barely perceive as any change in the patient's condition.
Mm-hmm.
And my research group has done a very interesting study. We had access to the clinical study reports that drug companies submit to FDA and other regulators. And when we look at these data, which are much more reliable than what the drug companies publish in prestigious medical journals, then we found out that in placebo-controlled trials of depression drugs, 12% more patients stop prematurely in the trial when they are on a drug than when they are on placebo. What does this tell us? Well, if you decide to drop out of a trial, it's because you do not think that the benefits outweigh the harms. So therefore, our study has shown that the patients prefer placebo.
Interesting.
This
Voting
is a
with their feet. Yep.
very important result.
Mm-hmm. But they don't report that in the final journal.
What
right?
do I mean? We published it.
You published. Yeah. Yes.
Oh yeah.
So I guess there's also a section of your book about coming off psychiatric drugs. Can you talk about what research you have done? I know you worked with Anders Sorensen and he got a PhD underneath you. What is the best way for patients to get off psychiatric drugs and leave services?
Well, he has written about receptor occupancy, how these drugs are bound to brain receptors.
Mm-hmm.
And Mark Horowitz in particular in the UK, he is a psychiatrist, but he is also in a way a psychiatric survivor, because he took a depression drug for a while, and then he was very surprised when he tried to get off it, how terrible the withdrawal effects were. And he has said that if he hadn't been a patient himself, he wouldn't have believed it could be so bad. Right. And I had the same idea due to my training as a doctor. When people told me how bad the withdrawal symptoms were, I looked at them and said, that can't be possible. It can't be that bad, but I now realize it's correct. Mm-hmm. And Mark Horowitz, Anders Sorensen, and others have written about, and myself included in the book, for example, we have written about the best methods of coming off the drugs, and you know yourself a lot about it because you help people doing that. Yep. And the most important thing is that virtually all guidelines were very wrong, because what they recommended was a very quick tapering, often just 2 weeks. And not only that, but they recommended halving the dose every time. So you halve the dose, and then you do it again, and then you have a quarter of the dose, and you do it again, you have 1/8 of the dose. And when you come down in small doses, it is far too quick. Mm-hmm. Then you have to go down much slower than halving the dose every time, because you must respect the binding curve to brain receptors, and doctors don't know about this. They think we are stupid, you and I, because they can't possibly have withdrawal effects when they just take a tiny dose of a depression drug or an antipsychotic. It's wrong. It's because they don't know basic clinical pharmacology.
Yeah, I often get really mad, Peter, when I read Twitter, because all of the arrogance and like the denial of withdrawal in patients, and just outright abuse toward patients that post on Twitter about withdrawal effects, trying to educate doctors, and maybe some of them don't do it in the most professional way, but I invite these psychiatrists, come sit with me for a day and listen to the stories that I hear all day. It's horrific. It's horrific. And nobody's ever taken me up on my invitation.
Pardon? Oh, they haven't taken it up.
No.
It's a human trait that when the truth is too painful, you turn your back towards it. When we heard during the Second World War what happened in the Nazi concentration camps, people, even including Jewish leaders, they refused to believe in these stories from the very few people who had succeeded escape from Auschwitz, for example.
Mm-hmm.
They just disbelieved it. And then they won't show up when you invite them.
No. And the stories I hear, Peter, I'm sure you've heard many of them. I started it because I had a breakup with a boyfriend in college, and 30 years later, I'm still on Lexapro, and I can't get off of it. I've lost my job. I've lost my support. I'm so sick. I can't shower by myself. No doctor will help me. There's no validation. I have to get off of this myself. And the suffering that I see is just so severe. It's almost unbelievable that a little tiny pill can just completely dismantle your whole brain and nervous system. And, it happened to me too. But it's just, to me, to see it on such a scale, like, I don't think I realized until I started working with people one-on-one, like, how vast and like widespread this is.
Yeah, isn't it amazing that we have created a world where you make more than 10% of the population take these drugs? And that means that we have hundreds of millions of people who will have a very hard time if they try to stop again.
Mm-hmm.
And this is a main reason why people continue year after year on drugs that don't help them, but actually harm them.
Yeah.
It's so perverse that you just get speechless.
Yes.
How is it possible to fool the whole world in this way?
And they did. Speaking of that, I just saw the FDA lower the age of Lexapro and Cymbalta to 7 and 10 years old. How do you feel about the widespread medication of children?
I have written about this stunt on Mad in America in an article, and I have also criticized the research that made the FDA approve escitalopram down to children only 6, as you say,
Mm-hmm.
if they have anxiety. It is incredibly harmful.
Mm-hmm.
These drugs don't work for children. That's what they say in placebo-controlled trials. They only work in the psychiatrist's mind, because they're the ones who, with their scales, judge if the drugs have helped. And these scales are very subjective, and the trials are not really blinded, because you can guess who get a drug and who gets a placebo because of the side effects. So it's more reliable to ask the children, and they tell you that the drugs don't work, but what they surely do is that they double their risk of suicide. How can you be so cruel that you use drugs that double children's risk of suicide? Shouldn't they have a full life like you and me?
Mm-hmm. Yeah, it's very upsetting to me too. Very upsetting. Let's see. I mean, I have so much we could talk about. What do you think, mental health practitioners? I know there's a section in the book. Everybody, there is in the comments, you can go read the book and go purchase it. We put the links below, but there's a section about classically trained practitioners. How do you, is there any hope? Like, is there any way that people that are currently practicing mainstream psychiatry or psychology can help this issue, in your opinion?
There is no hope if you look at professionals, because the drug industry is so powerful and so wealthy that healthcare is much more corrupt than people think it is. And family physicians, they use these drugs a lot. And why? Because the psychiatrists, they say that they are good for people. And the psychiatrists have been corrupted. We know that. And that means there is no hope via professionals, because money is such a strong factor. You can corrupt almost everybody with money, and that's what the industry does. So my hope is to count on the general public to tell them in books and films like Medicating Normal, where both you and I participated,
Mhm.
and we are going to make film in Denmark. I am doing a lot with a Danish documentary filmmaker, and we are launching our podcast series. We have actually already launched it on Spotify, and there will be a lot of episodes about psychiatry on that channel.
Awesome.
So I hope that since film, TV are strong media,
Mhm.
I hope that this is the way to convince people that it is utterly, utterly wrong what is going on, so that they stay away from these drugs.
Yeah. I
Oh,
find,
by the way,
oh,
by
yeah,
the,
go
by
ahead.
the way, Angie, you talked about this mental health survival kit book that
Yes.
has been published in USA, and with advice about how to withdraw from psychiatric drugs. I have recently published a book that people can download for free from my website, Institute for Scientific Freedom. This book is called Critical Psychiatry Textbook. What I thought was that people get indoctrinated at the university when they study medicine or psychology, or later when they want to specialize in psychiatry, they read these textbooks.
Mhm.
And of course, I had an idea that how misleading they must be. So I read the 5 most used textbooks in Denmark, and now I have written a whole textbook of my own, telling people what is wrong in these textbooks.
Mhm.
So I use science positively to demonstrate that all these ideas about psychiatric diagnosis being specific and reliable, and psychiatric disorders you can see in a brain scan, or you have a chemical imbalance with it, which is a total lie. And
Mhm.
these drugs, they are good for you and you don't become dependent on them, which is also not true,
Mhm.
and so on and so on. It is one big betrayal on a massive scale.
Yeah. Yeah. That reminds me, Peter, a couple years ago when the NICE guidelines came out, and they were very misleading, and you, John Reed, James Davies wrote letters back and then tried to get them to retract all that. Can you talk about that? Like, what happened?
Now, I've actually just written about this
Did you?
again.
Did you?
Yeah, because I've written a chapter for an upcoming book about withdrawing depression drugs. Well, we have complained about NICE and their guidelines, but we have also very much so complained to the Royal Society of Psychiatrists in the UK, because they said, I think it was in the newspaper, The Times, they said something about that withdrawing from these pills is not really a problem, and the withdrawal symptoms are pretty minor and they will be over in a couple of weeks, things like that. And then we complained to them and said, this is not true. And then they quickly took down a survey among patients they had done themselves that was up on their website, and which told a totally different story. And then we asked them, why did you take down this survey? Then we were told it's out of date, which was another lie. It was another lie. So John Reed in particular was very tenacious. He wouldn't let them go off the hook. And as I remember, we also wrote in the British Medical Journal, and there was so much publicity about this, and we wrote to the society that if you don't change this, you have put yourselves outside common norms. I mean, then you are not a decent society, and you don't respect the science, and just about everything is wrong. And then we actually force them to change their position, but it demands a lot of energy.
Did they put that back, or like change that?
They then issued some guidelines that were more reasonable after we had pressured them very hard.
Yeah. I think like Luke Montague and them helped recently, but I'm still not sure it's perfect. You know, it still doesn't, I mean, it's like let's give harmful drugs and then people can't get off of them. That's the practice. Like it doesn't even make sense, you know? Doesn't make
No,
sense.
no, psychiatry is not of this world. I have argued quite convincingly, I feel, that this specialty is so harmful that it should be abandoned.
Mm-hmm.
When a house is rotten, it doesn't help that you call in a lot of craftsmen. It's still rotten.
Mm-hmm.
So you need to tear it down and build a new one.
Yeah.
Where you give up your crazy ideas about biological psychiatry, that these disorders are all a consequence of some chemical processes. They are not. They're a consequence of the way we are living. Of course, there are people who become schizophrenic where we just don't know what happened, but traumas are very much related to later development of psychosis and schizophrenia. And the more traumas you have been exposed to in childhood, particularly sexual abuse and things like that, the greater the risk that you will become psychotic sooner or later.
Right. But that still doesn't mean treat them with antipsychotic drugs to fix it, you know, that
they don't fix anything.
They don't fix it.
And their original name was actually Honest, because when they came on the market over 50 years ago, they were called major tranquilizers. That's exactly what they do. They knock people down so they can't function.
Yes.
They can't think clearly. It's difficult for them to work. They might not be able to have sex or sustain social relationships. And oh my God, there are so many issues there.
I'm still amazed though, Peter, like how even people that I talk to, the culture is so entrenched. No, my drugs work. I need them. They help me. I would die without them. How dare you talk about this? You're stigmatizing people that with mental health issues, like the cultural wall that we hit. It's almost like I stopped arguing against people that don't believe it. It's not for me to try to convince them because they don't, it's just they get more backed into the field. Recently I talked to David Cohen at UCLA and I said, do you think this problem is getting worse or getting better? And he's like, oh no, it's getting worse. Biological psychiatry is like backpedaling. They're prescribing them at younger ages. They're doing more screening. And then I said on my end, I think it's getting better in a weird way that so many patients are being harmed, the whole family abandons psychiatry. So once that scale tips, when you harm so many people that people withdraw, that's how it might collapse, in my opinion. But he thinks the opposite. So what do you think about that analysis?
Unfortunately, I think David is right.
David's right.
He and his wife visited me this summer. That was great. Nice. I hadn't seen him since 2014 in Los Angeles, but they were biking in Denmark. So we had some psychiatric talks, of course.
Of course.
And unfortunately, I think he is right.
He's right.
Because the forces against us are so big that it does get worse all the time. And you mentioned these patients who believe that the drugs have helped them. Some of these patients are very belligerent and they are very vocal, and the media are sometimes almost afraid of them because they don't want to be called names and being against patients and being heartless and all that sort of thing. So I have written an article recently about why the media, when they write about psychiatric drugs, they get things terribly wrong almost all the time, particularly when they write about a suicide. Then their script is that then they must also have some people who are alive who say, oh, this drug saved my life, which is totally wrong. There is not a single psychiatric drug that saves lives. They kill an enormous amount of people. That's what they do. And when I debated with the Danish chairman of what corresponds to the English organization Mind on live radio, he said the same. Oh, we have patients who say that depression drugs, he called them antidepressants, which I don't, because they don't work for depression.
Mm-hmm.
Oh, they have saved their lives. And then I said, that's not a fair argument, because all those who were killed, they can't raise from their graves and say, hey, it killed me.
Yes, true. Good point. Good point. One of my favorite things that you've ever said, Peter, and I use it often and I think of it often, is psychiatric drugs take away everything that it means to be human. And I see
Yes.
that very often in my own life and others, but just like the pattern that I see is patients will say, or clients, whatever you want to call it, people will say, I never could quite like reach my goals, and I would have ideas and I couldn't come to fruition. I want to be creative, but I couldn't. And so in one aspect, through the doctor's eyes, the drugs are working because they're not complaining as much, they're not coming to the hospital as much. They're maybe some are managing anxiety, but then they add other drugs, whatever. But in the patient's life, when you ask, like, how are you functioning? Are you reaching your potential? Are your dreams coming true? Are you reaching your goals? No, they're not. They're not.
It's good that you take this up. Now I will ask you and the viewers a question. What do you think people on psychosis drugs miss the most?
Love, connection.
Yeah, of course they miss that. They miss themselves. They feel they're no longer themselves.
True.
Bob Whittaker writes about this in one of his books. What they miss the most is themselves. And then the Norwegian Psychiatric Association leaders from that organization wrote a horrible article in a major Norwegian newspaper this summer that ignited a lot of counter letters to the editor.
Mm-hmm.
And I mean, their article was just full of things that were incorrect. And one of the things I remember was that, oh, it's wrong when people think that these drugs alter people's personalities. Come on.
That's what
These
that's how
are
they work.
These are brain active substances. The whole idea is to change people's brains. And then you say, oh, they don't alter people's personalities. But if they didn't, why is it then that some people who take depression pills, they become emotionally numb? They don't care about themselves. They don't care about other people to the same extent as they did before. And this is one reason that they can actually become murderers in the worst case.
No empathy.
Because they don't have the same conscience as they usually had.
Mm-hmm. Yeah.
Isn't that to change people's personality? I believe it is.
Yeah. I mean, I think I've even gotten an argument on Twitter with a bunch of mainstream psychiatrists about these drugs do not have numbing effects. And I'm like,
oh dear.
Yes, they do. Are you serious? Like everyone I meet says, like, Angie, I can't. That's one of the reasons when I ask people, why do you want to come off psychiatric drugs? I need to know your why, because when things get hard, I might have to pull on that. And you need to know why you're doing this. And they will say, I don't feel like myself. I feel numb. I can't feel my emotions. I don't feel happiness. I feel like there's a glass wall between me and the world. That's what they say most commonly. But it's like, then what do the drugs do then, in your opinion? I don't,
Oh my goodness. Then you should also remember that these receptors that psychiatric drugs work on, they are very basic receptors you can find everywhere in the body. Mm-hmm. Even earthworms, they have serotonin in them. Mm-hmm. It's a basic biological substance. And when we are talking about numbness, some people become completely numb in their genitals. Yep. David Healy has described a woman who can rub chili pepper in her genitals and she doesn't feel anything.
No, it's true. That's true. The profound impact of just changing the human being, that it takes away everything that it means to be human. It does that in one way when you're on them, and it does it in a completely different way when you're trying to come off of them. And when you're healing from them, I mean, it's taken me years, Peter, to get my personality back. 20 years, it was gone. 20 years.
Well, sitting here today, talking to you, it's amazing. I just can't believe the condition that I know that you were in, and you talk about it in the film.
Yeah.
Yeah.
I'm back. I got my femininity back, my sexuality, my personality, everything. But and no help to them, despite them, in spite of them, not because of them.
Yeah, there is. I mean, it's also weird, and yet it's not weird. People who have survived despite the treatment that they were given, they call themselves psychiatric survivors. Now, if you have a heart condition and your cardiologist helps you survive, you say, I survived because of the treatments I got. In psychiatry, you survived despite the treatments you got. And if you survived a heart attack because you were well treated, you don't call yourself a heart attack survivor, really. You're just happy to be alive.
Right.
So,
right. I know
that,
I resist that title because it's like, I don't want that tie, like, but I totally agree with the sentiment. Yeah. And I find it very ironic, Peter, that now I have psychiatrists as clients or psychiatrists that text me for advice. And I'm like, wow, how the times have changed, you know? Or I hang out with them. I just stopped at Joseph Wood-During's house. We went for a walk and we hung out, you know? Like, it's crazy to me. It's still tides have turned, you know?
You know, I have made fun of this, and yet it is actually serious. For example, in my mental health survival kit book, I have this story of a Danish filmmaker who got a diagnosis of schizotypy when she went through a difficult divorce. And I never heard about this funny diagnosis, so I looked it up. And there are these criteria that you must fulfill to get the diagnosis. And when I went through these criteria, I realized that actually a good deal of psychiatrists, maybe most of them, could get a diagnosis of schizotypy. So maybe they should be subjected to forced treatment with their own drugs, psychosis pills. That would give them a very different view of these pills than they have today.
Yeah.
But isn't it says a lot about how crazy psychiatry is, because to get this diagnosis, you must, for example, have delusions. And what is a delusion? This is a strong belief about something that is not correct and that normal people can see is not correct. And now just think about the psychiatrist, many false ideas about psychiatry that the lay public disagree with, and the science disagrees with them. I would call that a delusion, a collective delusion.
Right. It is. It is. One of your quotes from Mental Health Survival Kit, who are the most mad on average, the psychiatrist or their patients?
Oh, did I write that?
Yeah, you did. I pulled it out this morning. And my other favorite one was when I was reading about the children, you said children should not be medicated. Perhaps psychiatrists need some psychoeducation about that. And I thought that was a good one.
But that's because when people complain about the drugs that they harm them, they don't want to take them, then the psychiatrist's standard reply is, oh, they're just stupid. They don't have insight into their disease, so they need some psychoeducation.
Right.
So therefore, I try to use their own weapons against themselves to show people how crazy it all is. And the thing about craziness, if the patients are more crazy than the psychiatrist, there is a quote that is ascribed to Einstein, but it's unclear. It might not be him. But one definition of insanity is doing the same thing over and over again, and then expecting a different result. And this is exactly what the psychiatrists are doing every day. And if a drug doesn't work, then they double the dose. And what does the science tells us? That doubling the dose does absolutely nothing. You don't get more benefit, but what you do get is a higher risk of dying and all kinds of terrible harms.
Mhm.
So this is insane, isn't it? I
is.
think it is.
Well, it's
So,
even worse than that, Peter, because they just add more drugs. Okay, this one is,
oh yeah,
you know, Rexulti commercial. Maybe I shouldn't say the trade name, but if your antidepressant isn't working, add this. It's like they're admitting in the commercial that it doesn't work.
yeah,
So here's another drug for that, you know?
yeah. I have seen so many cases, also people who ultimately committed suicide. I wrote about one of them recently, called Psychiatry Killed Tuva Andersson, a Swedish young woman who just suffered from anxiety. That was a problem.
Yeah.
And she ended up being forcefully treated with a very dangerous cocktail of drugs and lost all hope. There was nothing left for her. And then she suicided by taking a tricyclic antidepressant drug, which are well known for being very effective. These are very dangerous drugs. So if people want to commit suicide, they might succeed if they take a lot of these. Whereas if they take a lot of the newer depression drugs, they won't kill themselves. But they had even prescribed that drug to her. So she had too many tablets at home.
Yeah, it's terrible. So let me think. Let's check if we have any questions in the comments. I don't think so. Everybody's enjoying our conversation. Do you have, what do you,
well,
go ahead.
I'm not sure this world psychiatrist would enjoy our
No, it's too bad.
conversation.
Too bad.
Yeah.
Too bad. What have you seen over the years, Peter? Have you seen anything change? Have you had practitioners write to you and say, oh my God, you're right, I didn't realize what I was doing? Anything like that? Like, what have you seen in the field over the years? Or
Well,
just,
one of my very positive experiences was that I was invited in to become a member of the UK Critical Psychiatry Network, which almost entirely consists of psychiatrists, and then there are some family doctors and a few others. Of course, I'm also a doctor, but I never was a family doctor. I worked in hospitals. And this group of people are interesting. They are critical, and we have a lot of critical and interesting discussions via email. So we learn a lot from each other. And I shall have at least two of these in my coming podcast series, among them the one of the founders of the Critical Psychiatry Network. And I'm very happy that Mark Horowitz has also accepted to become a guest in my podcast so we can hear about his experiences. Right. So even though David Cohen and I are very pessimistic, I do feel that the number of people, including psychiatrists, that are getting critical is actually growing. I think it is, but our problem is that their leaders are beyond reach. They protect a very harmful specialty. That's what they do.
It's true. We did a film screening at Yale, Peter, and we were not allowed to be there. But the feedback that we got was the older psychiatrists, the more established, the staff, the faculty, they were very entrenched in the belief system and said that these stories in the film Medicating Normal are rare. You know, we don't practice psychiatry like that. But all the young psychiatrists, the residents, the students, they were like, no, this is a real thing. So that gives me a little bit of hope. But then I think, at what point are they going to be brainwashed into the corruption side and just blindly not believe what they hear from their patients? Because even like David Cohen, I asked him, like, how did you figure this out? And he goes, I just listen to my clients. They will tell you. So even me sitting here, I think you can't tell me. I see more than 140 people a month. I run 10 support groups. You can't tell me that mainstream psychiatry is not hearing about this. I don't believe it, Peter. I don't believe it. Yeah. I just don't.
But that's why my first psychiatry book that came out in 8 years ago. I called it deadly psychiatry because these drugs kill millions, and organized denial. Because the denial that you won't see, you won't listen, is organized. And if you don't do as your bosses expect of you, you will have a very difficult time being a young psychiatrist.
Yeah. Okay, we do have questions. Here's a couple really quick. Being Danish, what is the situation in Finland when it comes to professionals who have awakened? Does it vary by country, or is it just organized denial across the board, every country?
Oh, so this is one who thinks that being Danish, I know something about Finland. That's interesting. But of course, I do know something about Finland.
Good.
I have been there. I have lectured there about psychiatry. And Finland is a conservative country. It is definitely more conservative than Norway, Sweden, and Denmark. There are differences between our countries. And so it's difficult. It's difficult to change things in all countries, but it might be somewhat more difficult in Finland than in the other 3 Nordic countries. Now your voice disappeared.
Okay, how's that? I'm back.
Yeah.
They're finicky. Okay, one person asks, why does my antidepressant venlafaxine, it felt like it was helping me function for a bit, and then all of a sudden 4 years later it stopped working? Do you know what is the mechanism that seems to happen? Like, it seems to work and then it doesn't, and it harms me. Do you have any opinion about that?
There are many reasons for these experiences, and I believe one of the most important reasons is that everything in biology fluctuates, whether it's physically or in your brain. So if you feel you're getting better, you tend to think this is because of the drug. But scientific studies have shown that on average, people do get better, even if you do absolutely nothing, if you have a depression. But then people mistake it for a drug effect, because we know the drug effect is so small that in reality, they don't really work. And you can say the same if you take a drug after some years and you feel that it has stopped working. It might be because you would have gotten a new depressive episode anyway, at that point in time. So we cannot use individual experiences to say something about whether something works or not. That's why we do trials where we have a placebo group, because we know this is unreliable. You are gone again.
My headphones. Okay, sorry. Okay, I said it's so good to speak to you. I could talk to you all day, I think. Is there anything we can look forward from you? I know you said film projects, podcasts. Where can people find out about this? What's the best way for people to follow your work?
Well, the best way is to look up my website, Institute for Scientific Freedom. My deputy director and I publish a lot. Already after the first 6 months of this year, we had published around 50, not 15 articles. And the reason we can publish so much is that we try to avoid medical journals, because then you are exposed to peer review, where you have some grudgy people who think you are threatening their self-image and what they do every day, and then they come up with all sorts of idiotic complaints, and it can take years before you publish, if you publish in that journal. So we prefer to publish on the Mad in America website, on Substack and elsewhere. And the other thing people can do is to follow my tweets. They are easy to find, because on on my homepage, there is a Twitter handle and so on. So
yeah, and we put all your links in the comments so people can find your Twitter, where to purchase your books, your website, and how to read your papers on Mad in America. So all those links are below in the comments if you're interested. And
yeah.
Just Peter, thank you for everything that you do. Seriously, thank you. You're a voice for people like me, the people that I help. You're a sound person of reason, and it's just, we need more of you. Thank you for everything.
And yourself, please.
Thank you.
And I'm very happy you invited me. I had no idea that that it would run as it did. I really enjoyed it. So thank you.
Me too. Thank you, Peter. All right, everyone, we'll see you next week. Thank you so much for attending, and share the video if you feel so called. Thank you so much.
Thank you.